So to kick off the meeting, my name is Joe Morrison. For those of you who don't know me, I am the co-founder of Right2Breathe. We really started Right2Breathe based on a couple things. One, the fact that there are 12 to 14 million Americans living with COPD and they don't know it. So initially we started as a really awareness and screening, and we quickly grew into patient education and outreach and continuing professional education. We do a lot of different things, including obviously this pulmonary chat online patient support. Greatly appreciate your presence here today, and we're really excited to share some time with you. We do have a couple of our board members on the call. I'm thankful for our Director of Education, Michelle Da Silva, who is a respiratory therapist and has been with Right2Breathe almost from the very beginning. And of course, John Linnell, not only a board member here with Right2Breathe, but involved in many other places as well.
Recording is on.
And I believe we also have my mom, Allison Morrison, who is also on our board of directors. I do have everybody muted, so just so you're aware as you're joining in. There we go. So without further ado, actually, you know what I'm going to do? I'm going to unmute John and let John introduce Dr. Benzo, because I think it's better hearing from someone who has worked with the man himself. So John, let me unmute you. One moment, please. There you are. Okay, John, take it away, my friend.
All right. Well, hi, everybody. Thanks so much for attending this session. When I lived in Minnesota, Dr. Benzo was my pulmonologist once I had moved up from Arizona. And not only is he a good pulmonologist, his philosophy and teachings as to mindful awareness, mindful breathing, being aware of yourself, really made me understand that I'm in a lot more control than I thought I was of my body, myself, my COPD, my life, et cetera, et cetera. And I thought it would be excellent for us to hear from him directly. He is a clinician and a pulmonologist at Mayo Clinic. He also works in the hospital there. He has, I believe, 5 NIH grants that he's worked on. I've worked on a few projects with him. He's just a wonderful, wonderful man. And Dr. Benzo, I welcome you, and I thank you so much for being so free and giving of your time to us today. So take it away, Roberto.
Thank you very much for this opportunity. I feel like we're talking between peers here, and probably I'm in the disadvantage of probably not being as expert as you are in COPD. I'm a pulmonologist. I founded a lab called the Mindful Breathing Laboratory, and what we're trying to do there is promote pulmonary rehabilitation, and particularly home-based pulmonary rehabilitation, but with the addition of health coaching. And that means that we are trying to have a very significant conversation with people about what is important for them, and then to be very clear that COPD doesn't define people. And so the thing is, most of my work is about talking to people with COPD and see what is it that they feel is important for them as they live their life with COPD. And then I've been a student really because I learned so much. One of the things I wanted to say first is that my first crisis for how I actually got into mindfulness is because I was trained as a doctor to fix disease, fix stuff. And then I finished my pulmonary fellowship, and then I devoted myself to pulmonary rehabilitation and COPD. I realized that many times we still there with dealing with something that is there to stay in some way. But the other thing is, so So I said, how can we actually find meaning? How can we actually heal people, not cure, heal people when there is something we cannot fix? And that's where my journey started. So I think that of course, everything I learn, I try to put it in my own life as far as trying to deal with my own crisis. But slowly over the years, I was able to slowly put together this idea of how can we actually deal with the present moment as it is? And that is a very profound question. And most of the time, one of the things that need to be done for that is shut up and sit down. Something that most of the patients with COPD can do. And that has been tremendously enlightening for me. I work at the Mayo Clinic, where patients usually come when everything or most of the thing has been done. All the inhalers has been tried, and all oxygen has been is in place. Most of the pulmonologists all over the country that send the patient for a second opinion are saying, okay, I've done the oxygen, we done rehab once, and then he's on the triple inhaler, and what can we do now? So I think that we try to initiate with the patient is this idea of, okay, let's make a decision to live with life as it is. And I like to share with you something that was very profound to me, which is the concept of health. Health, defined by the World Health Organization, is a balance. It's not the absence of disease. So that means that we are healthy when we can deal not only with our COPD, but also with wife, husband, daughter, money account, my boss, my job, and everything else under the sun. So health comes from the root for health is come from the word whole. That means dealing with everything that is going on with you right now. So the thing is that then when you start kind of talking on that kind of terms, it's a different change. It's a change in paradigm. It's kind of again, most people like you already seek help. You got the inhalers, you got the oxygen, you got perhaps the 36th session of pulmonary rehab. But what about life? So the thing is, one of the things that mindfulness is called the attention to the present moment, non-judgmentally. That means that not saying it sucks or I like it, kind of as if we can nakedly look at life in the present moment. And when you do that, when you just sit down and shut up and then start to kind of try to be with yourself right now, not only you are much more poised in the critical moments, like let's say dealing with an exacerbation and knowing what to do, but also you get this sense of why you keep going, why you keep grinding. What is the reason for that? Of course, nobody can be happy when they are kind of having a difficult moment with the disease, but there is something about the meaning of life that happens, and that is something that we bring up. And people say very different things. My husband, my wife, my job, my kids, my whatever. So it's very personal, but it really needs a lot of attention. And this moment of pause where we actually come into that. Because if you ask people, okay, listen, tell me what is important in your life. I mean, most people would say my family, my kids, but many times, so how often your behavior kind of honor those meanings. So the thing is that what I'm trying to say is the following. We engage in a conversation for people to do things that are important to them despite showing of the breath. And so people identify things like visiting my father, visiting my mother, visiting my kids, doing this or doing that, doing my hobby, and then life starts to kind of light up in which there are things that are really important that you still can do. And that really needs a lot of courage, because we usually measure life in the way of what I used to be done or what I used to be doing in the past, and that I cannot do it anymore. So it's kind of a little bit of exploring, re-imaging, re-engineering life. And by the way, that happens for every one of us because we're all in the countdown, you know. But the point is that it's good to use the opportunity. And so the visit with me and the engagement into a home rehab project that we are so fortunate that we have NIH here, the National Institute of Health, that gave me money to actually try this home-based rehabilitation in which people are in their own home doing their own yoga, very, very simple, to just be a little bit more in tune with their breath and doing their own walking for balance. And one thing that I learned over the years is that balance in the body brings balance in the mind. So it's very, very important to kind of pay attention to the way we walk, to the way we move, because that, if you will, balance there bring balance in your mind, in your emotional intelligence. And then I don't need to tell you that you probably know when we are anxious or just too sad, I mean, our symptoms go up to the roof. And that doesn't happen only with shortness of breath. It happens with pain. It happens with fatigue. Our emotions drive a lot into our symptoms. So that's one thing. So how are we dealing with that? So let's say we are, and I'm going to pick on my friend John Linnell here. He is dealing right now with an exacerbation, and he mentioned that the way he actually kind of embraced that moment and perhaps start his prednisone and start his antibiotic is perhaps different after the practice of trying to non-judgmental, just sit down and try to be with it. That not only happened in COPD, probably also in Mayo Clinic, we have probably the best pain center in the world. And when the people are coming for the in-person 14 days training for dealing with chronic pain, we do not give them more medication or a special cocktail. We teach them to be with the pain, to embrace the pain, of course, when the pain is unbearable, you need medication. Like when you are very short of breath, we need a nebulizer, we do a neb, of course. But the point is that what is the in-between? That is most of our time, most of our life. So how do we embrace that, if you will, situation that we live in? So it's a very profound thing. It's kind of it's a different way of looking at life, in which you are not less by actually having a condition, because health is much, much, much bigger than that. Again, like when I teach this concept of health to patients or to my colleagues, I usually put a juggler there. And the reason I put a juggler is that a juggler needs to practice a lot. It's not that I give you a YouTube and you juggle after that. No, you got to practice a lot for that. I need to pay a lot of attention. And the same happens if we are willing to be healthy. That means we need to practice this sense of trying to pause and be with the situation as it is in the present moment, and then pay a lot of attention to that. And then I would say one of the biggest reasons we have these movements in the home-based rehab, the yoga movements, is because yoga means come from the word yoke, which is union. Union of what? Union with life in the present moment. That means that we do ridiculously simple movements with the upper extremities, with the arms, and ridiculously simple walking, that if you do it enough, you become kind of closer to your body. You are closer to identify your, to be able to be with your symptoms. I'm not sure you know that every time you get angry, before your brain knows that, your body tenses. So the thing is that when we do the yoga, when we do the simple movement, that again, I'm more than happy to share with this group all the videos that are related to that. It's an opportunity to be with our body as it is right now, not as we want it to be in 1 year or as it was 50 years ago. Now, so it's a special kind of rehabilitation, and the word rehabilitation that we all call rehab is very big. It means restore function, and restore function means restore function in life. When you talk to your kids, when you talk to your husband or wife, when you move, when you go to the grocery store, when you drive, when you do everything that you want to do, when you have sex, everything. So the point is that it's very mundane. So it's about being with life in the present moment. And the crude reality is that there is always right now. So there's nothing else that there right now. So it's, and again, it's nothing magic, but it's this idea of starting to observe more life in the present moment because it's the only life we have. And that is something that you can think is a cliche, but so it takes a lot from the thinking or saying something like this until you actually start to see it. You just need to have this opportunity to stop. And then when you stop enough, then you see more clear. Think about, let me just give you a kind of an example. If you have muddy water in a jar, the muddy water will be brown. But if you let that jar stand, the water stand, in some time, it will become clear. So clear that you can actually drink it. So the thing is, stopping allows our mind that is in all many directions, including our phone, our multiple devices that we are in contact with, allows to settle down, and we can see more clear. We see more clear what? Life in the present moment. And so there's a definite benefit of doing a practice like that is on top of all your intent, very valid and appropriate to cure what can't be cured. So be on the right inhaler, be on the right dose of oxygen, doing getting or not getting the Zephyr valve or the spiration valve, and so those are very important things to do. This is something else. That is the beauty. The beauty is that these come on top of all our efforts that we do to deal with, if you will, the physiology or the lung itself. The other thing I want to touch briefly in this idea of being present with life in the present moment is that there are some other stuff that can be pretty significant to how we feel. And that is what we eat. What we eat is really how we feed our body, and is being aware of that is an important part. Eat the right amount. Like in the yoga tradition, I talk too much about yoga, I'm a yoga teacher, but the thing is that one of the principles is to eat to 75% of your capacity, whatever that capacity is. And that's something you nurture, you get into the culture of doing that. So what we put in our mouth and how much we put is important for the overall how I feel. Because at the end of the day, how I feel is not just only your lungs. It's your lungs and how much you move and how you eat and what's the degree of sleep you have. So 7 hours is the ideal. The amount of water you drink. But the point is that, so think about that. What you eat is also an important thing, and the test there to see what it is that you need to eat is, how do I feel after? What is the aftermath of eating? So I think that, so you can see that on top of your rightful efforts on what the guidelines are saying that need to be done, inhalers, oxygen, mucolytics, lung reduction. On top of that, there's another level, which is how do you live life in the present moment in the context of problems, in the context of issues. So
actually, it's, Dr. Benzo, there's a couple of questions, and I think what you just said is a perfect segue into a couple of these questions. So from my friend Jan Cotton, her comment was that it's so hard to control emotions when on meds that cause such mood swings. And she writes that doctors take out prescription pads out immediately. So also Tala asks, how can I better manage intense emotions and stress? So I think this is related to Jan's question as well. How can I manage intense emotions and stress during this challenging time, obviously meaning COVID and what we're all living with here? In Tala is asking in order to avoid asthma attacks. So those are kind of two questions, and then there's another question following. But I thought those two were related because it's talking about managing, controlling emotions in the midst of stress or in the midst of things that are being triggered chemically within your body because of the medications we're on.
Okay, thank you for the question. One thing I like to say from the outset is that control is an illusion. It's about floating with, being with. So many of my patients teach me when I try to actually give them what is called the emergency plan for exacerbations. They tell me, "Oh, doctor, don't write 40 milligrams of prednisone because I'm ballistic. I cannot sleep, I cannot function. I actually yell to my wife. So it's good to know what kind of medication really affect your emotions in a particular way, and get into this discussion with your doctor about that. So the comment is so right. So often we are quickly to actually write something in the prescription pad and give something away, and that knowing that many medications can have side effects, and so I think that it's good to identify medications that don't settle well with you. Sometimes we need to compromise, particularly in the moment of an exacerbation. We need some prednisone, but how much do we need? That's the part that this is the fine tuning, the part that are not in the books, the part that you need to talk to your doctor and make sure your doctor looks you in the eyes, and then you actually kind of have a plan with you. Regarding stress is a part of life. Think about this. Think about a tire of a car or a bicycle. The stress is the amount of pressure inside the tire. If you have too much pressure, you blow up the tire. If you have not enough pressure, you don't function. So stress is part of life. The thing is that what is it? Identifying things that are pressuring you is important. And the question here is, what is in my control? What is it that I actually can change? You can change, let's say in the COVID situation, I can change not going to places in which people are not careful about using a mask. We can change about myself, being aware of my symptoms. So you can change about using a mask to protect others and try not to, to decrease the propagation of this virus. Some other things, so also you can change the environment in which you are, discussion in which you are. As you know, emotions are a kind of a part that we can do something about to control our breathlessness. And when we teach emotional intelligence, we don't do anything to completely stop the emotion. The number one thing of emotional intelligence is identify the emotion will happen. And the second part is that, what am I going to do with that? So what is my management of that? So the thing is that being sad is fine. If my mother died, of course I will be very sad, and that is appropriate. If I am sad because my team didn't win, and which is a problem that happened to me. I'm a Minnesota Vikings fan, so it's like so it would be inappropriate. I mean, so the thing is that how appropriate is your emotion for the moment, particularly, let's say, with anxiety. So this is identifying why you're having the emotion and if asking yourself, is that appropriate? Is that number one is that real what I'm thinking? And number two, is that appropriate? And it really takes time to learn to live and be okay with certain emotions. Some of us can be more prone to being more anxious or being more sad, and that's who we are. The point is that identifying the emotion and then is that asking that question: is that appropriate for the situation at hand? You may find yourself that there's a pattern of seeing half of the glass that is empty, and that takes us to anxiety and takes us to sadness. So I would say that in this working on what we call health, which is balance with life in the present moment, not just the lungs. The lungs is just a piece. Then husband, wife, kids, money situation, my car, my boss, all those stuff. This is life. So how we deal with that's true health. How balanced we are with that's true health. And then the foundations or what science have said that could be things that can help is finding meaning. So why I need to deal with this stress right now, and perhaps the stress is because you have somebody that is sick, but it's your husband and it's your wife, and then number two is learn to be with your body in those situations. Kind of learn to be with your body as you are dealing with those emotions. And for that's why we teach yoga. We teach the very simple movement, the pursed breathing, the diaphragmatic breathing, kind of getting your air into the abdomen and then to the chest and then to the upper chest and then down once you breathe out. The breath is an opportunity, is a tool used not by COPD patients, by athletes, by business people, to diffuse emotions, to decrease emotions. It's not our culture that we actually go and sit down and be with the emotion. We want something to fix it right now, and that is against. I mean, this is not what we try to promote here, or what I try to promote in the rehabilitation programs. So it's a very active process, because you need a lot of, if you will, a lot of grit to be able to learn this path of rehab, this path of being with your emotions, being with your body as it is. Be aware of what you eat. Try to move despite some shortness of breath, and instead of frustration or the idea that I used to do much more than this. So I guess this is a long answer for the question, but summarizing, kind of be aware of what actually activates you on the wrong way, and discuss with your doctor about that. Prednisone is a big offender for emotions. The other thing is stress is part of life. The thing is that what are the things that you can control not to be perhaps on a high stress that will make you explode. Maybe so, and that is a very personal question. The other thing is what is my style? Looking at the half of the glass that is empty, or is looking at the half of the glass that is full? Positive, looking at the half of the glass that is full now, right now in the present moment for you and me, is a very, very well tested method of improving well-being in the context of chronic disease. And I'm just saying chronic disease, you can say in the context of life. So it's much bigger than disease. And disease, again, is a piece of health. It's not everything. So that is what actually we'll try to convey with my patients for that, to actually find balance in the context of everything that is happening right now.
Excellent, thank you. Couple of other questions actually that are popping up in the chat. So Thelma says that her comment is this. She says, "I'm fearful of going out and about with stage 3 COPD. Is there any way I can breathe better with the mask?" And then after you answer that question, then I'm going to unmute Jan, because Jan wants to ask you a question too.
So we have to be really picky with the mask we use. There are some masks that are not that breathable, and it can be really a significant problem to actually move around. There are others that I'm using. There is like a cloth, and that you put it on top, and it's very breathable. Remember that we put the mask not to send what we have inside our bronchial tree to the environment. No mask protects you to get the virus in. So the thing is that I would just say, to me, was I think that we need to kind of find out the mask that allow us to be more comfortable, more breathable. Again, the one with the cloth is the one that I actually recommend the most. It's a very fine cloth. Actually, it doesn't have straps. The cloth has some cuts that you actually put into your ears, but it's very thin, and that allows you to breathe better. And the other thing is this. I totally get it. That is another level of difficulty. It's another thing that's coming your way. Yes, I got it. But the thing is that in this situation, we need to find out what is the middle way for us. So, because it's important to get out. It's important to see people. So perhaps moving slower, in which you need less ventilation, less movement of your breath, but just being outside. Being outside, being social, I don't need to tell you that. You know that better than me. It's important, and seeing the people that we want to see. So it's a little bit of a compromise. It's a little bit of a, find out what is right for you. My experience with the mask is what I mentioned before.
Excellent. All right, so I'm going to unmute Jan. Jan, go right ahead, my dear.
Hi, Doctor. I am so thankful that you're here, because you're answering a lot of questions that we all have. And one reason I have been in is because of the mask. Okay, I can't stand those surgical masks. Okay, and it's so difficult to breathe with those masks. But I want to go step back just for a minute, because I have gotten into, because of my clinician, my psychologist, on the mindfulness. But it is so hard, and let me tell you why. When I said prescription pad, I wasn't necessarily talking about a prescription pad for prednisone. I know within the last 5 or 6 years, doctors have tried to put me on 10 or 12 different antidepressants that did not work. That's the prescription pad they want to pull out. So after a while, you've been tagged as having anxiety 24/7. So they want to give you another pill to help you with this and that. And none of that appears to be working, because after a while, there's a kickback on that and you're not feeling well. Or your body becomes thoroughly addicted, because having been in the hospital so many times, they schedule these anxiety medications at a certain time. So they want you to come home and tell you, oh, well, just get off of them. You can't do that, because they scheduled it at 6 o'clock in the morning. So guess what? Your body's like, where's that pill? Where is that pill I'm supposed to take at 6 o'clock? And these are some of the problems that I have been dealing with, being in the house alone, not being able to wear the mask. My doctor has been really, really good at helping me wean off of some of these medications. I'm on no antidepressant at all, because my body rejects those. So is there any other ways that you can direct me to help me? Now, a few minutes ago, when we first started this webinar, this prednisone had me running in the kitchen to get a bottle of water and about ready to the bottle of water about to fall.
Recording it.
About ready to fall. So, and then, of course, you're not thinking about mindfulness then. You're just trying to think about trying to breathe and get back to the webinar. So any suggestion that you can make to help me with this transition, because about 3 or 4 years ago, there was a big major problem. And I was told that I really did have PTSD. And Karen, that's when you came to Florida and I got sick. So there's been one thing after another. So that's where I am now. And I'm willing to take any suggestions that I can, but I'm tired of that prescription pad. Well, let's try Prozac. No, we're not going to try any more of that. Okay? Because it's had me a complete nutcase. And I'm getting too old for that now. We have to be careful when we get into those 70s. Okay, and we get to be older and taking these medications. So any suggestion you would have for that or whatever, I'm even journaling now. Okay, and that's something I had not been doing, but I've noticed that that's helping also. So I would appreciate anything that you could direct me on. I would appreciate that. Thank you.
Thanks, Jim.
Yeah, thank you. Thank you for your comment. And let me say, number one, that the treatments of sadness or anxiety that has a bigger, long-lasting effect are more behavioral treatments than medication treatment. Medication works a lot and is necessary when we're trying to harm ourselves. But one of the things I would recommend you directly right now is either the practice of very, very simple seated yoga. And then again, I will be sharing with John links for everybody to have those sitting practices, and also the practice of meditation. And the practice of meditation is very simple, and we may be able to do just a little practice here together, and so I can initiate you on that. But the point is pretty much sit down and try to be silent and try to recognize the emotions that are happening, like your frustration when you weren't going to the kitchen and you said, I cannot really think of any mindfulness there. I just need to get the water and come back to the webinar. Mindfulness is not a thing. It's about being with life in the present moment. Mindfulness in that moment is how you walk to the refrigerator or how you sit in your chair right now. So it's a complete break to look at your life now. And then, so that's why my recommendation to you are very straightforward. You already have done a lot. You work with your doctor, you're agreeing with him about medication. I would probably just try to practice something that slows you down. And that is not an easy thing, but it's a tremendously rewarding practice. So if Joe or John, if you'd like, we can do just a very short practice right now. I like everybody to sit in your where you are with your back straight and your head upright, as if you're trying to be half an inch taller. And relax your shoulders and relax your arms and smile, even if you don't feel like it. Smiling means 44 muscles of your face telling your brain that you want to be here, you want to do this. So this practice is called the 10 breath practice. And the 10 breath practice means just that. We'll pay attention to the in-breath as we smell through the nose, as if you're trying to smell a rose. And then we pay attention to the out-breath as we breathe out, pursing our lips, as we know very well, as if we're trying to flicker a candle. And we'll do it for just 10 breaths, using our fingers for that. So, and we will close our eyes when we do that. So, is that okay if we do that right now? So let's get started. 10 breath practice. Start your in-breath now. And everyone will follow their own pattern of breathing in and breathing out until you complete the 10 breaths. Importantly, as you are doing the in-breath and out-breath, if your mind is full of thoughts, it's okay. Just bring your attention down and back to the breath. It's kind of you starting to learn to handhold your attention to the breath. And you repeat that again and again during the 10 breath practice. Nowhere to go, nothing to do. Just sit, feel your in-breath, feel your out-breath. And if you care to, you can do a little hold of the in-breath as you go to the top of your lungs. And then breathe out, long, 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 long. And we COPDers, I think that we know very well the importance of breathing long out, so we can deflate our lungs and have a good, full, fresh in-breath coming up after. So do a little bit more, just a few more breaths. And when you get to the breath number 10, you just open your eyes and come back. So this is the 10 breath practice. And I truly recommend that every time you feel overwhelmed, every time you feel like you are in an exacerbation, every time somebody treats you not well, every time that you feel like you need to respond more than react to life. Kind of this ability to digest a little bit life in the present moment and then just find out the right response from you. This is a kind of a very hands-on practice, nothing really special. It's ridiculously simple, but it's very, very profound. It may affect the way you respond to life instead of react to them.
Thelma says that she also finds when she puts on meditation music, it helps with the stress. That's absolutely, I would agree with that. That can certainly, music can be a great way to help you kind of focus yourself and take you out of a stressful moment based on what that music is that you're listening to.
Let me complement that with the fact that ask your question, does it work? Does it work for me? I mean, it doesn't mean don't believe anybody. Don't believe it in me. Don't believe what I'm saying. Try it. Find out if that makes you quiet, more kinder, more compassionate with yourself. So I think that don't follow any recipe. Just try everything, and then see what works for you.
Love that. Absolutely. And one of the things that Allison says here is that one of the problems for anyone with or without COPD is we sometimes want complete success right away. As Dr. Benzo using the word practice, and I think that is a very good point at closing, saying be patient with yourself, and that sometimes relaxation takes practice. So I thought that was a good point and wanted to share that.
And that we are all in the practice, so it's like it's not for patience. So you're just a human being like me. We all need the practice of relaxing with life, and in a way, and relaxing means stop resistance. It's not a muscle thing. It's to stop resisting life in the present moment. And when you stop that, when you learn to sit down and shut up and be with life in the present moment, you will start to find out what are the things you can and cannot control. When you get to that point, everything opens up. Even if today is your last day in earth, it doesn't really matter. It's about the balance which will happen with you now. That is the promise of mindfulness.
Did you notice that Dr. Benzo started and ended with sit down and shut up? In other words, listen to yourself and be aware of what's going on
and relax. Be in the moment. I mean, isn't that right, Roberto?
Yeah, and so again, it's a very personal recipe, and you need to find out what works for you, and then the key to see if you're in the right direction is that am I more kinder and compassionate with myself and with others? Am I more able to see difficult things? Am I responding to life or reacting to life? Those are the fruits of the practice. So it's not just about doing stuff that people said is good. It's about doing them continuously to kind of create neuroplasticity in your brain and then see that works for you. That is how you close the circle. And so it's not about waiting for the rain to stop. It's about dancing in the rain. That is the essence of life. So I guess I thank you dearly, every one of you, for listening. And as I said, I can probably spend hours, and then probably because I am the student here, if I were to kind of listen more, and everything I am is because what my patient told me. And so I wish you well, and thank you very much, everyone.